So today's class is on occipito-posterior position. All of you know the commonest position in labor. The commonest position in labor is occipito-anterior, but in certain less than 5% case can be occipito-posterior. So you please see this case. This was a 28-year-old primary gravida was referred from District Hospital Kottayam as a case of PROM, that is premature rupture of membranes and failed induction with mobile head about 6 hours after leaking. On examination of the patient, there was subumbilical flattening, the uterus was full term, the head was a deflexed, mobile head, the fetal heart rate was on the right flank, and there were mild contractions. On pervaginal examination, the cervix was soft, fully effaced, 3 cm dilated, membrane absent, clear mature liquor was draining, there was a deflexed head, it was an right occipito posterior, the pelvis was normal. So all of you know this is a normal position of the baby in labor, that is the occiput is in the left anterior quadrant. But we call it as a malposition. Occipito-posterior is a malposition when the occiput is on the posterior part, and whenever the occiput goes to the posterior part, it's usually on the right side. So our right occipito-posterior. And this is an important cause of a mobile head in a primary at occipito-posterior. The incidence is 10% at the onset of labor. Right occipito-posterior will be more common than left occipito-posterior. This is because the left oblique diameter is reduced by the presence of sigmoid colon, and the right oblique diameter is longer than the left one. So that is why right occipito-posterior is more common. Also, dextro-rotation of the uterus also favors an occipito-posterior position on the right side. What are the etiological factors of occipito-posterior? One important reason is the shape of the pelvis. Andropoid and android pelvis are the most common cause of occipito-posterior position. Then kyphosis, maternal kyphosis, the convexity of the fetal back fits with the concavity of the lumbar kyphosis. Then when the placenta is inserted anteriorly, anterior insertion of the placenta. And another reason is a high inclination pelvis. These are the common causes. And how will you diagnose occipito-posterior? On inspection, the abdomen looks flattened below the umbilicus due to the absence of the round corner of the fetal back. A groove may be seen below the umbilicus corresponding to the neck of the fetus. Fetal movement may be detected near the midline in the anteriorly. On palpation, the fundal grip will be getting the breech, the umbilical grip, the back will be